Great. Thank you very much, Paula, for reminding me. And without further ado, I think I'm going to give the word to Paula to begin this webinar today. And I will mute myself.
Hi, everybody. Good morning or good afternoon or good evening, depending on where you are. Well, as Bea introduced me, I'm Paula Andalo. I will be sharing a screen because I prepare a PowerPoint. I'm old-fashioned, but this PowerPoint, I promise I will not be reading it. It's only to, you know, guide the conversation. Please feel free. You have to disable me, Bea, to share the screen. Yeah.
Hi, Paula. So
you have to disable as a host. You have to make me a host to share the screen.
I have to figure out how to do that, and I'm sorry, everybody.
No, it's fine. And please.
Advanced sharing also. All participants. Okay, there you go.
Okay, great. So please feel free to show your faces and ask me questions, because this is only a presentation, but I would love to hear from you guys. So I'm the ethnic media editor with Kaiser Health News. I will explain what Kaiser Health News is in a few minutes, but what I like to talk about, or I want to begin this presentation with two big questions, or what I think that are big questions. One is, why is it important to have a media in Spanish in the US? And basically everywhere, especially in the countries where there's a big Hispanic population. And why is it important, the diversity in the media coverage? When I talk about diversity, I talk about diversity in testimonials, in reporting, in coverage in general. To put these ideas in context, it's important to know the Hispanic population in the US that has been increasing a lot in the last years. So, but the key point is not only how many Spanish are in the US, but also how many people still speak Spanish at home and use the Spanish to connect with the media. As the slide says, according to the Pew Hispanic Center, there's 37 million Hispanic people that still consume information and the media in Spanish. And as you know, this is a very dynamic number. Why? Because it's true that there's more people from Hispanic heritage born in the US, and there are small, but at the same time, there's also people coming in that these people have the Spanish as a first language, and probably they don't speak English, or they don't speak a level of English to read or consume or watch news in Spanish. So I will be talking, of course, a lot about the United States because it's the country where I work and it's the country where I live for the last almost 20 years. But I think that this could apply to, of course, different places. Having a media diverse,
Please mute yourself if you are busy somewhere. Please mute yourself.
And sorry, I really think that having a multicultural media, a media in different languages, that means that we are talking about democracy. It's impossible to have a democratic coverage or a democratic media if we goes to all the different angles, and the demographics are part of the reality of the country. That means that it has to be there at some point in some way. About Kaiser Health News, this is a very interesting new phenomena or new area of journalism that is really pretty new in the United States. To talk about Kaiser Health News, I have to explain first what Kaiser Family Foundation is. Kaiser Family Foundation is a foundation that had been in the US for, I think, more than 40 years. Even if the name has the last name Kaiser on it, for the people that live in the United States, this is not related at all with Kaiser Permanente, that is a health insurance. Unfortunately, we share the name, so some people think that we are part of the health insurance company. Kaiser Permanente is a health insurance here in the US. We are not. This is a non-profit organization that is focused on health policies and health laws, and it produces a lot of research and surveys related to what is happening in the US with the health system. As you may know, the health system in the US is one of the most expensive in the world and is one of the most inequitable in the world. So there's a lot of things to say about the health system in the US. But during 2010, under Obama administration, you know that the government launched a new health reform, the Affordable Care Act, that is popularly known as Obamacare. And this new law, what tried is to expand the health market in an affordable way to have more people coverage. In the United States, believe it or not, there are over 25 million people that lack of insurance or have a very precarious situation, economic situation, so they cannot have or insurance through their employer or insurance in a private way. So at that moment, that year, Kaiser Health Family Foundation launched what was and still is the newsroom, the only newsroom dedicated exclusively to health reporting. The name Kaiser Health News, and at that moment in 2010, it was only a newsroom of, I think, 6 or 7 people. Now it's a newsroom of over 50 editors and reporters in DC, in Washington, DC, and in San Francisco, California. And there's also a bureau in St. Louis, Missouri, and there's reporters and editors all around the country, in Florida, in Connecticut, in Washington State, etc. So it grows, it has been growing a lot in these over 10 years. And it basically is very distinctive because we produce content that people, media can take by free. This is a non-profit, so it's not a wire service, it's not a service on demand. The New York Times, the Washington Post, the media in Spanish can take the stories and also the photos or the videos, and they can put the stories and our content on their websites. So this is a very new way to do journalism in the same channel as, for example, ProPublica or the Marshall Project, that are non-profits here in the US that produce investigative reports, and they offer that content for free. In 2016, seeing that this demand or need of content was growing, we launched the Spanish strategy at Kaiser Health News. So I began to work with what we call partners to disseminate the stories in Spanish. What I basically do is translate the stories that are in English originally into Spanish, but also create content originally in Spanish that I translate into English. And of course, I have been a voice inside the newsroom to advocate for more voices, in the coverage, more Hispanic testimonials, but also more Hispanic health professionals quoting in the stories. So as you can see in the slide, our content is almost everywhere. In these slides, you can see stories in MSN Latino, that is the MSN platform in Spanish, in Univision, in Telemundo, Medscape. Some stories goes all around the United States, but also as Medscape is a Latin American platform, it goes to Latin American. And this is some of the stories that I translated and are in our website. Again, the focus is translating or producing stories that everybody is interested about, but promote the focus on Latino people that are in the US and their stories. We also translated the stories into Chinese and Vietnamese. This is not my work specifically, because of course I cannot edit in that languages, but we have an editor in California. She's from Vietnamese origin, and she's doing that work specifically in California. We also have a huge presence in Spanish in social media. I created a Facebook group called Hablemos de Salud, talking about health, that already have like almost 400 members. So we try to disseminate this content everywhere. Why? Again, because if the coverage is more diverse, that means that more voices are there, and there are a lot of communities that are underrepresented, that are more vulnerable, and they're voiceless. So we need to talk through the stories about them and with them. And also because when we write more about the minorities, something that is really bad, that is the stereotype, begins to dilute. And we need to do a lot about that. And what we try to do, or at least what I try to do with Kaiser Health News, is having a long-term impact, because we know that there's some moments in history that promote and changes, and that is great, that is our engine, our motor, but we need to do that changes more, constant, not something that lasts only for the time of the crisis or the social crisis. The COVID-19 pandemic, with all the bad things that brought to us this year, also give us an opportunity to fill that gaps in a very strong way. Why? Because on one hand, the COVID pandemic magnified the gap in healthcare. We know the numbers of people are highly disproportionate. The people are more sick and dying more in minority communities. So the work in journalism is more important than ever to fill that gap. In the US, there are over 650 media in Spanish. Maybe you know the big platforms, of course, CNN in Spanish, as I mentioned before, Univision or MSN Latino or Telemundo. In Kaiser Health News, we really try to reach most of them with reliable content, something that I didn't say before, but it's important to mention. These newsrooms specialized in health is basically formed with people that came from health journalism from different media, Washington Post, the New York Times, Los Angeles Times, etc. So it's about having everybody together working for the same goal, that is distributing this content for free to everybody. And why? Because I think that diversity is democracy and vice versa. So if we have that two words together, I think we will be working on the right direction. And when I mention diversity in reporting, it's not only having the Latino reporter or editor working with Latino testimonials or the Chinese reporter or editor working. I think everybody needs to be able to work with different communities, no matter their race or ethnicity background. So I think that is critical. And well, saying this, I really open to any comments or questions. And I really appreciate this time. If you want more information, I'm totally able to send you or chat with you, do another Zoom. So muchas gracias.
Thank you so much, Paula, for the presentation. And if you have any questions, we can wait for the Q&A. Maybe we can have Ahmed go ahead and then we can open for Q&A. But I just want to underscore that a lot of the content that Kaiser Health puts out on health is available for free, as Paula said, and can be adapted. So not everything is, a lot is based on the US, but some of it is much more general health news. So it's interesting to know for folks, and then maybe you can tell us about the protocol and how if people need content. Let's go to Ahmed now and have him tell us a little bit how his platform is filling gaps in health reporting in the Middle East, in Arabic-speaking countries, where health is not necessarily a news beat that is already established. Over to you.
Thank you, Pia. Hi, Paula. Well, can you please mute yourself, Amin and Christian? Aminta?
Yes.
Can you please mute yourself?
Okay.
Thank you. And Christian?
Yes.
Can you please mute yourself?
Okay, I'm trying to do that. Oh. Wow.
I can mute all and then you can unmute yourself, okay?
Hello. Thank you, Pia. Hi, Paula. Hi, dears. Thank you for this opportunity to display my experience with العيادة.com. My name is Ahmed Abdeed. I am an Egyptian journalist. I started my career in 2006 at a newspaper dedicated to health and continued my career in Egypt until 2015, when I have been honored as the best journalist reporting health. Then I moved to Morocco in the far west of MENA region, where I worked for 2 years and a half before moving again to Lebanon in the east of region, the east of the MENA region, where I worked for 3 years. So I got around in all the MENA region countries. During these years, I learned about the state of journalism in the region. So when the pandemic began to spread, I expected the challenges facing the region, especially regarding to journalism specialized in health, in terms of institutions and journalistic skills. And when Internews asked me to be the regional pandemic advisor, I didn't surprise. I didn't surprise that the region doesn't have a single website or 20 journalists dedicated to health journalism to help more than 400 million Arabic speakers in this region. So these 400 million Arabic speakers don't have a single website dedicated to health journalism. So from day one, we started, Internews and I, to support journalists with the skills for facing this emergency. But how can our training be functional unless there is no place to publish stories? From this point, we started to create El Ayada. And El Ayada means the clinic in English. As the first website dedicated to health journalism in Arabic, by Internews financial and technical support to give our colleagues the chance to produce their amazing stories, such as a story of survivors from double death, which is about women with cancer who go to receive chemotherapy doses under the civil war in Syria. Another story about COVID killing without infection, which is about chronic disease patients who died due to not receiving periodic treatment due to hospitals overcrowding with people infected with coronavirus. These stories and another fantastic ones produced besides awareness multimedia production for non and low educated communities in our region. So today I want to thank Internews who believed in my idea and for everyone supported us to raise the voices of everyone who needed a way to be heard. Thank you.
Thank you so much, Ahmed, for giving us really an overview of what you're trying to do and the important gap that you're trying to fill, especially at a time that we're living now during a pandemic where health is really at the top of the news agenda. So I want to open the floor for any questions. I see that someone, Tarian, commented something very interesting in the chat, because I think that in many parts of the world, there really isn't a dedicated health site, for example. And so it'd be great to, yes, thank you for putting that in the chat, Paula. I would like to start with a question for Paula, and then maybe others can also think about questions for our two speakers. Paula, you have written a book on HIV AIDS, and you've covered infectious diseases for many, many years. You've studied at the CDC, the Center for Disease Control, Prevention and Control in the US, so you have a strong health background. How does the coverage of news during this pandemic compare to the HIV AIDS epidemic of the 80s and the 90s? Is there anything that you see that is similar and or different?
Yeah, definitely there are a lot of similar things. First of all is how the question that the reporters have to ask themselves is how to report on the uncertain things. Because at the beginning of the pandemic, we basically didn't know anything about the virus, the new coronavirus. we learn things much faster than when the HIV epidemic began, but it was challenging, and I think that we need to deal with that, with the uncertainty of, because even the doctors didn't know what was happening. So that was critical. There's always also a component of education about things. I'm used to say that the masks now are what the condoms were in the 80s, because we need to use it, and I mean, everybody can have the virus. It's also two diseases that confront ourselves with our own prejudice and discrimination. We saw in the past what happened with the gay community, and now we can witness what happened with the Asian communities and how they are discriminated because of this wrong knowledge that they're guilty people when the epidemic happens, and it's not. That is totally wrong. So, I mean, answering your question, yes, there's a lot of work, and we also witness big institutions making mistakes. The first CDC guidelines, I mean, pointed out to a lot of situations that were problematic in the country, and both pandemics highlights the inequities in the health systems, in the access to healthcare, and the barriers that the vulnerable communities have to access to the healthcare and to the medication, and now the vaccines.
Thank you, Paula. Thank you for that. Does anybody else have some questions for our speakers? Feel free to unmute yourself and come on. Yes, I see a hands up. Kath.
This question, how do both of you strike a balance in your respective newsrooms to report for both like a community household audience as well as like an academic kind of research-based audience? So looking at the balance between human interest health reporting and kind of the more intensive science health reporting. Thank you.
Ahmed, do you want to respond, or you want me to do it? When we began to report about the HIV epidemic, things changed a lot, because in health reporting, the doctors used to be the gods, where the reporters used to go to collect reliable information. The HIV coverage changed that and put in the paper and now on the websites and everywhere different voices, the voices of the patients, the voices of nonprofits, the voices of the health departments. So in my point of view, the Kaiser Health News reports for consumers, so it's very important to have the scientific data, but also to put faces in the stories. So I think that some of the stories are more focused on the scientific aspect, for example, of the COVID pandemic. That is, stories are very interesting for doctors or the scientific community, but my focus is on consumers, and my focus is, as I mentioned before, in big platforms, news platforms, but also in local papers, because I really think that part of the gap is to have people that don't used to have access to reliable information in health, to give them a good information, sometimes decodify or digest as explainers for general audience. So that is the balance for me. Use reliable information in a high quality way, but for everybody to access everywhere.
I want
Thank you.
to I want to add something about reporting health, Paula, because now we are facing this problem to how to write stories for everyone, for low educated people and low educated communities dedicated to health, which is very difficult topic. That's a challenge now in our experience at La Iada. So now we are working on training our journalists to storytelling, how to convert this difficult topic, tough topic, to a very smooth story and words, which is available or anyone can read it and use it, and not to be very difficult or hard in reading.
Yeah, I totally agree. And about the question that is in the chat about the financial support, that is important, very important point. In the case of Kaiser Health News, it's supports by the own endowment of the Kaiser Family Foundation, but also receiving grants from other foundations, from universities. But what we never receive is money from pharma, from pharmaceuticals. That is a norm that we follow, and a lot of other media not, because they are commercials or they are different. They have different interests, but in Kaiser Health News, pharma money is not there.
I see another question about the funding our stories or financial support for health.
That is the, yeah.
It's a very important question, and I think both of us and all media dedicated to health asking now. So what I'm thinking about now, I'm thinking about go to every organizations all over the world who are interested in health, spread awareness about health, about topics of health, such as UN agencies, such as donors. And I'm thinking about the last choice to go to go to hospitals or another customers for or agencies for health to get advertisements from them or fund. So what do you think, Paula? I want to listen.
Well, as I mentioned, I mean, in Kaiser Health News, we receive grants from different non-profit organizations and foundations, but never from the pharmaceuticals. I think that there's a big conflict of interests if a media specialized in health receive money from pharma, from the pharmaceuticals. That is like a Bible. But I think that network that you mentioned, that could be great. I mean, because the health journalism now is everywhere, because everybody is writing about COVID, but we have, at least in my country of origin, in Argentina, and here in the US, responding to one of the questions in the chat, we have a health journalism and people specialize in health. What we didn't used to have is enough space in the media to put that stories. That is a paradox. Why? Because if you think about one bit in journalism, health is probably the only one that crosses everybody. Everybody has at some point or diabetes or high blood pressure, an infection, an ear infection, an STD. So it's something that really concerns to everybody, or a loved one with some disease, cancer, whatever. So what we COVID is doing is maybe open that space to other health coverage. That is exactly what the HIV/AIDS did in the past. I mean, I think that HIV opened doors to the health coverage, more health coverage in the media. Hopefully, when the pandemic ends, we will be still having that space. I really don't know. And hopefully Kaiser Health News still exists, of course, but that is important, to have the space for a special field that is really important to everybody.
But what I'm thinking about, Paula, it's about the conflict of get fund from private sector and our work as a journalists. We have to investigate on their work. How can they use the pain of people to get benefits and make money and make wealth? And in the same time, we can't get money from them for producing our stories. So I see a big conflict in this point. So I said that is the last choice to get fund from private sector, but not from all the sectors like pharma or another factor. Can you?
That's a good point. Sorry, I just also want to make sure maybe Paula, when you answer that question, then we can let others also ask questions. Maybe I'd be curious, there's people from different parts of sub-Saharan Africa, also if there anything that, in their opinion, having lived through also the HIV AIDS pandemic in sub-Saharan Africa and what they're seeing now with COVID as reporters. But Paula, please go ahead and answer Ahmed, and then we'll open again.
Well, as I said, I think, receiving funds is always conflicted, but it's also conflicted to work to the New York Times, that is a private newspaper, it's a private company, so that they have commercials or ads about specific medication. So in this world, denied we cannot be in denial that we don't need money to produce stuff. The point that I tried to make before is where that money comes from. In the US, it's 100% unethical to receive money from the pharmaceuticals if you are in health coverage. There's a conflict of interest, because if you receive, I don't know, money from Kaiser and you cover the COVID vaccines, and you mention Kaiser, there is a suspicion that Kaiser is behind that mention in the story. So to be free of that, what the journalism here, or at least Kaiser Health News, did is decide not to have that money. What the foundation is doing is receiving money from, for example, schools of journalism. They have an agreement with the University of Missouri, and they receive money in form of grants for the St. Louis Bureau. And for example, California received money from the California Healthcare Foundation, and different foundations. I don't have the list, I probably is online, but all the money comes from the own foundation investments and from nonprofits. That is the way that I think they are doing here. And I agree that the pharma money is not the money that you can use if you are in health coverage.
Anyone else that has questions?
Well,
Hello, can you get me?
Yes. Please go ahead.
Okay, thank you very much. My name is Tayang. I'm from the Cameroon Association of Major Professionals. Brilliant CV there from Paula and nice presentation from Abdeed. I hope I get it right, Abdeed. Yes, okay. I just want to please to find Abdeed.
It's okay.
All right.
Don't worry.
Okay, great. I want to find out from Paula if she could come back to her slide on diversification, the need to diversification, the need for major diversification. I want her to come back for it at least for like a minute so that I could get some notes on that. That is, if she's not going to be sharing her presentation, then she could just come back on the slide on diversification, the need for diversification. Thank you.
I think it's
Sorry,
diverse voices,
Oh,
diversification.
yeah. The diversity, you mean?
Yes, diversity.
Well, I cannot hear you very well. I don't know why. There's some noise in the microphone probably, but yes, if you mention the diversity in coverage, you want me to talk more about that?
Yes, I want to talk a little bit about that on the diversity coverage.
Well, it's very. I have to tell you that it's very challenging. Most of the newsrooms of the mainstream media are in the United States. People that are not from minorities, and it seems that they don't have. I don't know. I cannot say the skill, but they don't have in their minds the diversity as an important part of their daily work. But there are some reporters and editors that are trying to change that. And that means that, for example, if you are covering, I don't know, a new vaccine for COVID, I mean, you can not only look for the Caucasian doctor. There's a lot of doctors from Asia, India, Africa, Latin America that can also talk about that vaccine. They have to put that people in their loops. And also being more diverse when they look for testimonials. I used to say ironically, I'm from Argentina, so I'm very ironic, that I want more Marias and less Marys, or a balance between Marias and Marys in the coverage. That means that we need people from different races, ethnicities, as voices in the coverage. And we also need to be clear, as I mentioned in the presentation, that it's about what the country is. I mean, the US is a country full of different ethnicities, and we need to reflect that if we really want to do a democratic coverage. But it's an ongoing effort, as the name of my presentation. It's not something that we can do one time. It's an ongoing effort, believe me. I work with mostly Caucasian editors and reporters, and I'm repeat my mission that is more diversity every day.
Thank you, Paula. I wonder if this issue of diversity resonates with other people, other journalists in this room, and how they tackle diversity in their own countries. It's interesting. I see in the chat that Diane from Rwanda says that basically health reporting, there's still barriers into covering during COVID. I think she means maybe other health topics, despite the fact that they're focused on COVID, but mental health, and it's hard to, yeah, that's what she's saying, that's what she means. Is that something that you've seen, or maybe either one of you?
Well, basically, COVID cover all the health issues or go over all the health issues. So with different stories, we have to remind ourselves and the consumers and the audience or readers that, I mean, there's still a lot of stuff going on with another diseases or conditions, but about mental health specifically, not only there's a lack of coverage in general, but there's a lot of coverage of mental health related to COVID. So there's different, gaps there. It's always challenging. I don't know why talking about mental health, but during COVID, the mental health issues raised a lot. And I think there's not enough coverage about that.
Yeah, that's a huge topic, right? I mean, mental health in general, the stigma around mental health, and then in COVID, the increase of mental health. And I don't know if this is the same in all but it sounds like in Rwanda, that too. Diane, her comment makes me think that it's not being covered, and yet it's an issue also in Rwanda. It's impacting people.
Bea, but by the way, we started a weekly online program for mental health only with a professor called Hussein Omar. Now he is playing or be a guest every week with us in Al-Ayada online to answer questions for everyone for 1 hour and a half about their problems based on COVID or emergency cases all over the region and another stuff.
That's awesome. That's very, very good to hear, Ahmed. Thanks for sharing that. I know we're getting towards the end of the hour. I want to be respectful of people's time. So if anyone else has a question or wants to comment, maybe.
I write my mail in chat. If there is anyone want to ask anything else later, you are very welcome. Okay.
Yeah, that's good. Maybe pop your email there so that people can reach you.
I will do the same in case somebody wants to contact me or to know more.
And Paula, if you have a link to your book, please put. But anyways, I guess people can.
I cannot find the link right now, but I will send it to you.
Yeah, no problem.
Oh, sorry. I make a mistake and I send in the email again. It's a double A. Oh, I don't know why it doesn't take. Let me see. Now it's P-A-U-L-A.
Oh, okay.
A.
You have an extra A at the end. Got
Yeah.
it. Got it. Any last moment comments on health gaps in health reporting?
I think that this is a topic that it deserves.
I think Aminat, sorry, Paula. Aminat is trying to say something. I'm not sure if he's. I think he's trying to say you have to unmute yourself. Maybe I can try to unmute.
We are not listening. We cannot hear you. You are mute. Now.
Yeah, you can, yeah, go ahead. Aminate.
Yeah. My name is Aminate, Community Miller for the Community Initiative for Development Communication, Cameroon. So I've been listening, I've been following the debates very closely, and I am interested in context-specific challenges of health coverage, especially for community media and for underserved and hard to reach areas. We have talked about the issues of diversity. We have raised a lot of issues, but in our own context, we still have this very huge challenge of reaching out to communities that, first of all, are hard to reach. Some are affected by conflict and things like that. So, what would you pick? What approaches do we think are be most appropriate to reach populations in these kinds of areas, especially in a context where there may not even be radio, no internet, and probably we have to use traditional methods of communication and things like that. Because when we talk about coverage, there's a gap that we have to look at in our context, which needs to be filled.
I remember when I was covering HIV AIDS, there were a lot of initiatives in Africa with radio programs because people maybe cannot have a good internet access or a computer, but the radio used to be the most like democratic media to use. So I think that well, first of all, I think that everybody needs to have access to technology. The governments need to work on that, but that is a different topic that we can talk a lot about that. But considering what we have now, I think we can use radio programs to disseminate information, for example, about COVID, or educate people of why they have to use masks, or keeping the social distance, or eventually, if the vaccine is available in the country, to go and be vaccinated. The media, themselves, newspapers, internet platforms, well, they can send reporters to talk to different communities, no matter how far and how difficult to access is, if they're really interested in having everybody, you know, reflecting in their coverage. But here in the US, for example, there are a lot of rural communities without internet access, or reservations where Native Americans live without a proper internet access or connections. And well, in Kaiser Health News, they try to cover and to do some coverage, but I think it's not enough. We definitely need to do more.
Thank you, Aminata. That's a very good question. And I would like Ahmed to maybe, because he has worked with journalists that are in Syria, in conflict zones, and he knows maybe some insight about that.
Yes, I'm working with journalists in in 4 countries, which have civil wars and big conflicts. But I'm sorry, do you asking about how to deliver our stories to them, or bring good stories from there? What's the specific question? How to report this report?
How to access the communities that are difficult to access.
It's a very big topic. We made about 6 training for this point. How, yes, how to training about personal safety, about covering under crisis, about healthcare systems during the civil wars and natural crisis. It's a very big issue. It's not a simple sentence I can say, but well, training, it's very important in this point to save yourself and save your story and your sources.
Well, what Ahmed mentioned about safety is important. In Kaiser Health News, for example, they provide the reporter with all the, you know, not only masks, but this big plastic stuff that people put, and gloves. So the media is responsible also for the safety of the.
Yeah, it's souls and lives of people, so we have to be in responsibility of this situation. So before sending a journalist to civil war or pandemic or another crisis to cover this situation, we have to train them very well to save their lives and save their source lives and their stories to make a great story. We made it with a story I mentioned in my presentation, which is about women with cancer who go to get through therapy doses in hospitals in another cities during the civil war in Syria. So our journalists moved from city to city during the bombing and the war to get this story, and she campaigned women in their commute from hospitals and back. So maybe we can help each other in this later or organize that for our health journalism network to do that.
Yes, I think I will take note of Aminate's question because we have a strong department in humanitarian reporting. So there is definitely some training we can provide with that. And we have some people that have really supported journalists in conflict zones. So thank you, Aminate, for the question. Thank you to everyone who has joined us, and a special thank you to our panelists, to our guest speakers
Thank you so
who have
much.
shared.
Thank you,
shared and your journeys, where you are now and what brought you to where you are, and for everyone to come in from different parts of the world and being open to hearing and understanding and trying to translating to your own area and environment where you are. So thank you very much. Stay connected and stay close and stay safe.
Thank you so much, everybody.
Thank you, Paula.
Bye, Ahmed, Bea. Thank you so much, everybody. Thank you. Have a great day.
Thank you. Bye.
You too. Bye-bye.
Bye.